If you're thinking about switching to a plant-based diet, one of the concerns you may have is if you will get enough vitamin B12. What is vitamin B12? Why do you need it? And where can you get it? B12 is one of those vitamins that must be consumed in your diet because your body doesn't produce it for its own use. It's only needed in trace amounts and is commonly consumed via animal products such as beef, chicken, fish, eggs, and milk. Why is B12 so necessary? Well, deficiency in this vitamin leads to what's called pernicious anemia. Pernicious because it's irreversibly destructive to nerve and brain cells, and anemia because it affects your blood. A lack of B12 will cause your red blood cells to enlarge, which keep the cells from dividing.
B12 is very unique in that it's incorporated into the nervous system, and you can have issues of peripheral neuropathy, numbness, and tingling, or more likely imbalance, inability to sense where you are in space. Additionally, you can get a B12 deficiency that manifests as dementia. And the challenge is that the problems with the neuropathy may not be reversible, which is why it's very important to not wait until your B12 levels are low to do something about it.
So what are some good plant-based dietary sources? Plant sources with naturally occurring B12 include some fermented soy products such as tempeh and miso, and also some seaweeds. But since natural levels of B12 can vary and may not be as reliable, a good way to ensure you're getting sufficient B12 is to consume plant foods fortified with B12. These foods include many dairy alternatives for milk and cheese, such as soy, almond, and rice. The nutritional label should list whether or not it's been fortified with B12, and it will also be included in the ingredient list. The common American dietary source of B12 is animal products, but where do the animals get it from? Well, as it turns out, B12 is produced by soil microbes located in the root of plants. However, because plants get a good scrubbing before we eat them to remove the potentially harmful components, most, if not all, of its B12 content is removed.
How long can our bodies store B12? It's a good question to ask because we don't really have an answer. We know that we can recycle the B12 in our body through the bile. It gets reabsorbed then into the small intestine, and then it's used again. Unfortunately, we don't have a clear picture as to how long that lasts in the body. It may be up to several years. Depending on other deficiencies that a person may have, it could be as few as a few months.
It's hard to store several years' worth of vitamin B12 if you do not consume enough to start with. Groups that are at greatest risk of vitamin B12 deficiency include older people, those with Crohn's disease, celiac disease, gastritis type A or B, vegans, those who are pregnant, people who take acid blockers, or anyone who's had surgery to remove or block portions of their stomach or small intestine. Those who fit into any of these at-risk categories may consider getting a B12 test from their doctor in order to determine if they have sufficient levels.
If you're a total plant-based vegan and you don't consume any animal products at all, then you should make sure that you get a reliable source of vitamin B12, and that could be either through fortified foods and or a supplement. You could have a supplement like this. This is a sublingual B12 tablet, and it has 500 micrograms in each tablet, and you can just stick it under your tongue and let it dissolve there. You can do that once a week or once a day. But the best way really to know is to get your B12 levels checked so that you know where you stand.
The recommended daily allowance is about 20 micrograms. Oftentimes when you go into the grocery store and you look for B12, you'll see it in doses of 100 micrograms, 1,000 micrograms, 2,000 micrograms. Part of the reason may be that we may not absorb all of the B12 that we necessarily take in orally. Given that we usually recommend, if someone is supplementing B12, taking about 1,000 micrograms daily, and then periodically checking your B12 levels, especially if someone chooses not to supplement B12, they definitely need to make sure that they're rechecking their levels at least yearly, because deficiencies in B12, especially the nerve damage that it can occur with it and the dementia, may be irreversible.
So if you're thinking of moving to a plant-based diet, Remember to get enough B12 from 4 to 5 sources. It's not hard in this day and age to get plenty of B12, and it shouldn't be a concern for you, and certainly not a reason to keep from moving to a plant-based diet. I'm Reese Rafferty with Your Life and Health.